Welcome to Suhail's Paramedical and Nursing Academy. In the previous lecture, before I am going to start the lecture, I want to say one thing. Remember in life, whenever you want to do anything in the life, don't keep in mind what people are thinking about me. Remember this point. Don't keep in mind what others are thinking about me. And this is the main problem that affects a person to achieve any kind of goal. So what you want to do by your own will. Don't think what the surrounding environment will think about me. So this was all actually that I want to say before starting the lecture. So the today's topic, in previous lecture I was explaining about the hemodialysis. So in hemodialysis, what we was doing what the blood was taken out from the patient continuously and continuous into the dialyzer, and from dialyzer continuously this blood was re-entering into the patient, and during this process the blood was coming out from the body. Remember this point. And the semi-permeable membrane, there was the thousands of tubules was there in the dialyzer, which acts as a semi-permeable membrane, and that where the exchange of fluids and where there is the excessive fluid will be removed out, as well as the excessive nitrogen wastes will be removed out from the blood. Remember. And one more thing in case of hemodialysis, so that was the patient. Why we are doing the in case of hemodialysis, we have stated the definition, the indication, the contraindication. I have told about AV fistula, AV graft, as well as I told about what are the reasons behind the AV fistula, AV graft, like all the things that I have explained already. So today, the topic today is peritoneal dialysis. So before I am going to start, I am going to tell actually what is peritoneal dialysis, why we should do the peritoneal dialysis, why, if there is already the process of hemodialysis, why should we go towards the peritoneal dialysis? This the question comes in the mind. So remember the point, remember the thing that first peritoneal dialysis, what is peritoneal definition? First I will tell the definition, then I will tell indication why we are going towards the peritoneal dialysis. So the indication is very simple, that is first I will say the definition. Peritoneal dialysis is a process. Peritoneal dialysis is a process in which the dialysate, that means the fluid, is installed into the peritoneal cavity. Then this fluid is retained there for some time. That time is called dwelling time, that I will say later. And then this fluid is removed out from the body. Along there will be presence of, when the fluid is removed from the body, from the peritoneal cavity, this fluid will be having, this dialysate will be having nitrogen wastes as well as excessive fluid. So this whole process, the installation of the fluid into the peritoneal cavity, then allowing it to exchange the substances between the dialysate as well as the blood, with the nitrogen wastes which are present in the blood. So this exchange and then the removing of this dialysate from the peritoneal cavity, the process is called as peritoneal dialysis. So first there are three words, important thing. First we are doing peritoneal dialysis. The incision is made at the peritoneum, at the abdominal, in the abdominal region. The incision is made in the peritoneal cavity. So the peritoneal cavity is a cavity where many organs are present. Suppose small intestine, large intestine, liver. So these organs comes in the peritoneal cavity. So this peritoneal cavity surrounds number of organs there, and there is the presence of fluid in the peritoneal cavity. It is called peritoneal fluid. And inside the peritoneal fluid, what we are going to do? The peritoneal cavity will be surrounded by the peritoneum, the peritoneal membrane. The peritoneal membrane will act here as a semi-permeable membrane. Remember, the peritoneal membrane I will explain by the diagram. See. What we are going to do, this is the fresh dialysate. The fresh dialysate will be, actually I have recorded this lecture already, but due to technical issues it was not recorded. So that's why I have already written here. This is what this is called as dialysate. So the dialysate bag is here. This dialysate bag is containing hypertonic dextrose solution, mostly 1.5% or 2.5%. Okay. This hypertonic dextrose solution, 2.5% will be more hypertonic than 1.5%. So this dialysate fluid will be installed. Into the peritoneal cavity. This is peritoneal cavity, and In peritoneal cavity, this is called drainage. Okay, see, this is called inflow. This is called inflow. This process is called inflow when this fluid will be installed. When this fluid will be installed into the when this fluid will be installed. Wait one second. When this fluid will be installed into the peritoneal cavity. Okay, so this process is called as inflow. Mostly we are using here, I have written peritoneal dialysis has a cycle. It has three processes. In this there are three stages. One is called inflow, another is called dwelling, another is called drainage. The inflow means this fluid will be installed into the peritoneal cavity. How much fluid? Mostly 2 liters. For 10 minutes this fluid will be installed into the peritoneal cavity. Then there will be a dwelling time. Dwelling time, it will be mostly some 20 to 30 minutes, or it may be hours, depends upon the type of peritoneal dialysis that I will tell you later. Okay, so here the dialysis, the fresh dialysis enter into the peritoneal cavity. Now there will be a period of dwelling period. In dwelling stage, what will happen? The excessive nitrogen wastes which are present here in the blood vessels that are surrounding the peritoneal cavity, these excessive nitrogen wastes, this excessive fluid which is present in the blood, these nitrogen wastes will be removed out by this hypertonic solution, and they will enter into the peritoneal cavity. So when they will enter towards the peritoneal cavity, how much time is there? Mostly it will take 20 to 30 minutes, I told, or it may be hours. Then after the equilibrium will come. When equilibrium will come, equilibrium means when the substances from blood, that is nitrogen wastes as well as excessive fluid, will not show any movement towards this peritoneal fluid, towards this dialysis that we have installed. So what will happen here? There will come an equilibrium. Equilibrium means there will be no net change in both sides. So there will be no entry of nitrogen wastes towards the peritoneal cavity. Then after this dwelling period, we are going to now drain. The third process is drain. Inflow, dwelling time, then drain. In case of drain, this drain is done for mostly 10 to 30 minutes, or we can say 15 to 30 minutes. This drain is done. Drain means this fluid containing nitrogen wastes as well as containing excessive fluid will be removed out into the drainage bag. Here. Okay, so this will be the dialysis along with nitrogen wastes as well as excessive fluid. This is the process. This is drainage bag, and the catheter that we are using is called as peritoneal catheter. In peritoneal catheter, remember one thing. Here is a key. This key you have seen mostly in dialysis wards. In case of hospital, we are seeing this kind of key. This key actually it was present here, but this time I think whether it is here or not, it went somewhere. It was here. No. So next time I will send that image, the image of that key which is present here. I will put on the last of the video. In this key, what will happen? We can change the direction. Suppose we can first during inflow, the key will be in this direction. The fluid will enter into the peritoneal cavity. Then what will happen? After the fluid will enter, now we will close it. Then we will wait. That is called dwelling period. After waiting for some time, we will keep the key open this side. Then the fluid will be removed out, will be drained out. Then that time the key will be open this side, but that side closed. This side the key will be closed. Okay. So this was the process. So indications. So this all about, I was telling the peritoneal dialysis definition. What is the process? What is the peritoneal dialysis cycle? And what is the indication? If there was already presence of hemodialysis, if there was a solution for us, that is called as hemodialysis. If there was already a solution for us, that is called as hemodialysis. Why we are going towards the peritoneal dialysis? Remember, the indication is mostly the patients who are the children as well as the old patient. The children as well as the old patients will not be having such vascular access. The vascular system will be weak in case of child, in case of child as well as in case of old people. So for those childs as well as old patients, we will do peritoneal dialysis. Because I told you in hemodialysis, vascular access is important. Either temporary vascular access or permanent vascular access, that I have already explained in the hemodialysis. Here, there is no need of vascular access. Directly we will make the incision at the peritoneal cavity. In peritoneal cavity, the fluid will be installed, the dialysate will be installed, which is a hypertonic dextrose solution. Then it will be retained for some time. Then it will be drained out. This process is called peritoneal dialysis. So the blood vessels are surrounding this peritoneal cavity. The blood vessels which are surrounding the peritoneal cavity, from the blood vessels, from the blood, these nitrogen wastes as well as excessive fluid will move towards the peritoneal cavity. Remember, through a peritoneal membrane, that peritoneal membrane act as a semi-permeable membrane. That peritoneal membrane act as a semi-permeable membrane. So here a natural membrane is present. That is called a peritoneal membrane, which acts as a semi-permeable membrane. Okay, what is the indication? One was if there is patient children and children as old patients. There are some patients who have bleeding disorders. The patient is having bleeding disorders, we should not go towards the hemodialysis, because we are taking out blood from the patient. It is not as easy process. Taking out blood from the patient, if there are high chances of clotting, that means we should be careful about that. There should not be any high chance of clotting. There should not be high chance of bleeding disorder. If bleeding occurs inside the body, when we are taking out blood and inserting, we have to keep in mind there should not be any kind of bleeding. Okay, so the patient is having high bleeding tendencies. For those patients also, we should not do hemodialysis. Then we are going towards the peritoneal dialysis. Okay, so this was all about indications. Now, after indications, before we are going to the types of the peritoneal dialysis, I will take contraindication. For which patients we should not do the peritoneal dialysis. So contraindication is mostly the patients who already undergone chest surgery or abdominal surgery. We all know when there will be surgery at the abdomen, we should not go towards the peritoneal dialysis. Another thing, if there is any severe abdominal wall cellulitis. Okay, here see I have not written. See, it is severe abdominal wall cellulitis. Okay, if there is cellulitis, if there is any bacterial infection, if there is infection at the peritoneal cavity, it is called peritonitis. And presence of colostomy, ileostomy, nephrostomy is also contraindication. Colostomy means the colon is a part of large intestine. So we are opening the colon outside the body and we are connected to the colostomy bag, because patients who are suffering from any kind of obstruction, that time the excretory material or any other disease, if the patient is not able to go for voiding. So in case of large intestine, there is a region colon, and this colon we are opening outside the body. It is called colostomy, and the colostome bag will be connected to that region, and the excretory material will enter into the colostomy bag. Similarly, ileum is a part of the small intestine. Same opening will be done outside. That is called ileostomy. The same purpose, colostomy, ileostomy purpose is same. Nephrostomy. Suppose in case of if the patient is having tumor in the kidney, if there is presence of tumor in the kidney, remember what we are going to do. We are going to do the incision at the kidney, and we are going to remove that tumor part from the kidney. That is called nephrostomy. Or there may be any other purpose for the incision and removal of tissue, okay, from the kidney. Okay, another is recent or chest or abdominal surgery, I have already told. Then bowel distension or movement disorder. The patient is not able to move. If the patient has a bowel disorder, bowel distension means there is a distension of the abdominal region. That time also we will not go towards the peritoneal dialysis. These are the contraindications. And what are the types? The main thing is, that is types. After that, I will tell the complications. The types, there are three types. One is called automatic peritoneal dialysis, another is called continuous, and the third one is called as intermittent peritoneal dialysis. In case of automatic peritoneal dialysis, an automatic peritoneal dialysis machine will be used, in which the dialysate will be inserted before starting the procedure. How much fluid we are going to insert, that we have to connect before starting the procedure. Then during the night time, during the night time for 10 to 12 hours, this automatic peritoneal dialysis machine will do automatic peritoneal dialysis. So no, there is no need of observation during the night. Automatically it will do. How much we will set the value? It will do mostly 4 or more than 4 cycles. It will do during the night time. For one cycle will be mostly 1 to 2 hours. So during the night time means for 10 to 12 hours, 4 or more than cycles, 4 or more than exchanges per night it will do, and each exchange will be 1 to 2 hours. Okay. Another is continuous peritoneal dialysis. In case of continuous peritoneal dialysis, there will be what? The peritoneal dialysis will be performed after every 2 hours. So 2-hour break will be given, then peritoneal dialysis will be restarted. That is called a continuous peritoneal dialysis. Here 2-liter dialysate will be installed into the peritoneal cavity 24 times. Remember, 2-liter dialysate will be inserted, but 4 times daily. It will be done 4 times daily. So 4 times daily it will be done, and the dwelling time here, I told the equilibrium, the time to give the time for the dialysate to remove the nitrogen wastes from the blood, to remove the excessive fluid from the blood, that is called dwelling time, that is 4 hours here. In case of intermittent, another type is intermittent peritoneal dialysis. In case of intermittent peritoneal dialysis, the dialysis will be done intermittently. Intermittently means in 1 week it will be done for 4 or 5 days, and some days will be given gap within the week. That is called intermittent peritoneal dialysis, and this dialysis is done 4 times a week, I told. And the timing of peritoneal dialysis will be 10 to 14 hours. So it is a slow process. It will be done very slowly, 10 to 14 hours. And if this peritoneal dialysis is done during the night, then this peritoneal dialysis will be called as nightly intermittent peritoneal dialysis. So actually this classification is for what basis? It depends. The classification is done on the basis of inflow time, dwelling time, and drainage time. The first thing, if this classification is done as per the rhythm, which time we are doing the peritoneal dialysis, how many times we are doing the peritoneal dialysis. For that purpose, we have this classification has been made. There are 3 types. Last one is complication. In the next lecture, I will explain the nurse's role. That is the important here. For nurses, the important is nurse's role. That I will make a small video for that separately. That will be definite. So complication is what? What will be the complication in case of peritoneal dialysis? If we are doing the peritoneal dialysis, the main complication will be peritonitis. So infection is main complication here. Infection will be there mostly there will be the chance of infection, because if the sterile technique is not followed during the incision, during the peritoneal dialysis procedure, that time what will happen? That time peritonitis infection may be there at the exit site. So we have to be careful first from infection. That is complication. Hernia is another complication. When we are making the incision, there are chances there may be the protrusion of abdominal organs through the incision. That the process that is called as hernia. So hernia may be also the complication here. There are different types of hernia that will be explained in the future. Another is hydrothorax. If there is accumulation of fluid within the thoracic region, and if there are catheter release problems. Suppose there is a catheter, so there may be the chances this catheter may twist. So twisting of peritoneal catheter may occur, or there may be the no flow through the catheter. So if there is occur kinking or displacement of this catheter, if there is occurring, that is also the complications. We have to be careful about these things. Mostly there will be the infection, that is the main complication here. So in the next lecture I will explain the nurse's role in case of peritoneal dialysis. And one more thing, in the ongoing lecture I am going to make a video about cell cycle. I am going to make a video about, because in the cell biology I have not explained the cell cycle. I will explain each and every part in cell cycle. That will be more beneficial for all of you. I think I have told everything. Thank you so much. Thanks a lot.